Hello, everybody. At the outset, I would like to thank Dr. Shashank Shah and his team, specifically Dr. Radhika Shah, for having invited me here. And I'm going to be talking on, sorry, benefits of plant-based diets. It's indeed a time when veganism or plant-based diet has become very, very popular. And I'm grateful to Dr. Shashank Shah to give me this topic. So, what is the definition of plant based diet? Because whenever we try to understand a concept, we begin right from definition. Uh, pardon me, a healthy plant based diet aims to maximize consumption of nutrient dense plant food while minimizing processed food, oil, animal food, including dairy products and egg. So, here I want all of you to note this that healthy plant based diet in, involves consumption of nutrient dense plant food and minimizing consumption of processed foods. So, whether it is packaged foods or processed foods otherwise like consuming highly processed grains, etc., oils. So fat intake is low and animal food, which includes dairy, eggs, but also more specifically in Indian context, I would like to point out that it would be ghee and ghee products that are included here. It encourages lot of vegetables either in raw form or cooked form, fruits, beans, peas, lentils, soybeans, seeds and nuts in smaller amount, and this diet is generally lower in fat. Leading proponents in the field have varying options as to what comprises the optimal plant-based diet. Ornish diet, which is very, very popular across the world. Ornish et al. Recommend allowing animal products such as egg whites and skim milk in small amounts for reversal of various metabolic disease. And we know now diabetes reversal has come into fashion, but Dr. Dean Ornish around 20 years back had proposed reversal of cardiovascular disease with plant-based diet, and this was his program. Reversal program in the Cleveland, sorry, Cleveland Clinic Wellness Institute recommends completely avoiding all animal-based products as well as soybean, nuts, and particularly if there is severe coronary artery disease is present. Okay, so what is the difference between plant-based diets and vegetarian diets? This is something very interesting, especially in Indian context. Often plant-based diets are used interchangeably with vegetarian or vegan diets. And this is very, very true in this country where vegetarianism is very popular. Remember, vegetarian diets cannot be exchanged for plant-based diet. Vegetarian or vegan diets are adopted for ethical or religious reasons and may or may not be healthy. So very, very prudent example would be sort of Indian diets, which are truly vegetarian in so many places where individuals are vegetarian for generations, but these diets are not healthy. We are seeing it with a surge of metabolic diseases across this country because these diets, though they are vegetarian in nature, A, they lack vegetables and fruits in large proportion, which is a key of plant-based diet. And second thing is that they are very high in processed foods. So whether it is processed grains, it is intake of oil, and it is very, very rich in saturated fat, which comes either from dairy or it comes from ghee, which is used very, very predominantly in vegetarian diet. Pardon me for my cough. A key distinction is that although most of the diets like vegetarian, vegan, lacto-ovo-vegetarian, lacto-vegetarian are defined by what is excluded and plant-based diet is defined by what is included in it. And that's the main difference. Like you would say vegetarian diet means there is abstinence of meat. Okay, whether it is poultry, whether it is fish, any kind of meat is abstained from. Okay, vegan diet will abstain all animal products, whereas plant-based diet, it actually includes a lot of whole grains and other vegetables and fruits. So this is a beautiful cartoon where it is shown that what are benefits of diets which are essentially plant-based. So data is linked to better health outcomes in adults like heart disease, cancer, BMI, and cholesterol. And there are a huge number of changes in metabolome and altered gut microbiota. In children, there is limited data, especially on health and development. And of course, there is possible nutrient deficiencies which can come around from lack of vitamin A, vitamin D, lack of cholesterol, and essential fat like docosahexaenoic acid, but the data is extremely limited. Okay, so obesity, this is actually Obesity Awareness Month, and Dr. Shah has done this program because it's a Obesity Awareness Month. So let's begin our discussion with the base of all metabolic disease, that is obesity. Obesity and nutrition is related to chronic diseases. So we know obesity leads to chronic inflammation, which can lead to CVD, type 2 diabetes, and even dysbiosis, where there can be inflammatory bowel disease, colitis, and colon cancer. And now we have a lot of data to prove this. But now, when we are living in COVID times, we have seen that obesity and chronic inflammation actually worsens the results in COVID infection. So if somebody has obesity or any of these metabolic issues, then their results post-COVID are not as good as otherwise. Obesity. So epidemiological studies sorry, indicate that vegetarian diets are associated with lower BMI and lower prevalence of obesity in adults and in children. And again, here I would like to emphasize vegetarian diet here essentially means plant-based diets. It does not mean the kind of vegetarian diets that we have in India, which are very, very rich in fat, because in India we see that very, very strict vegetarians also have a very high prevalence of obesity and metabolic diseases. Meta-analysis of adult vegetarian diets estimated a reduced difference of about 7.6 kgs for men and 3.3 kgs for women, which resulted in 2-point lower BMI. Similarly, compared with non-vegetarians, vegetarian children are leaner and their BMI difference becomes greater during adolescence. Studies exploring the risk of overweight and food groups and dietary patterns indicate that plant-based diets seem to be sensible approach to prevention of obesity in children. And I think with increased prevalence of obesity in children across India, it is very, very prudent to start including plant-based diet, which excludes consumption of confectionaries, which includes consumption of sweets and highly processed fried food. Plant-based diets are lower in energy density, high in complex carbohydrates, fiber, and water, which may increase satiety and resting energy expenditure. Plant-based dietary patterns should be encouraged for optimal health. Diabetes. Adventist Health Study found that vegetarians approximately have half the risk of developing diabetes as non-vegetarians. In 2009, a study involving more than 60,000 men and women found that prevalence of diabetes in individuals on a vegan diet were about 2.9% compared to 7.6% in non-vegetarians. So you're seeing there is a drastic drop when individuals become vegan or plant-based, especially when there is lesser consumption of confectionery, sweets, and fried food. A low-fat, plant-based diet with little or no meat may help to prevent and treat diabetes, possibly by improving insulin sensitivity and decreasing insulin resistance. Bernard et al. Reported in 2006 that the result of randomized clinical trial comparing a low-fat vegan diet with a diet based on American Diabetes Association guidelines. People on low-fat, and here the key word is low-fat. Low-fat vegan diet reduced by their HbA1cs by 1.23 points compared to 0.38 points on people with American Diabetes Association diet. In addition, 43% of people on low-fat vegan diet were able to reduce their medication compared to 26% on those on American Diabetes Association diet. So you'll see that the difference is twofold. Twofold more people were able to reduce their medication when they went on plant-based diet. Plant-based diets and cardiovascular disease, and this is one area which is the most researched. A low-fat vegan vegetarian diet is only dietary pattern that has shown cessation or reversal of atherosclerotic plaques in clinical trial when combined with exercise and stress management. Vegetarian diets are associated with reduced risk of cardiovascular disease in general, including reduced risk for ischemic heart disease and cerebrovascular disease. In European perspective, investigation into cancer and a nutrition study, vegetarians had 32% lower risk of developing CVD as compared to non-vegetarians. Systematic review and meta-analysis of 8 prospective studies among Seventh-day Adventists, vegetarian diets were associated with 40% reduced risk of CVD events and 29% reduction in cerebrovascular events as compared to non-vegetarian. A recent systematic review of meta-analysis of 86 cross-sectional and 10 cohort prospective studies reported that a protective effect of vegetarian diet against the incidence and or mortality from ischemic heart disease. This observed risk reduction compared with non-vegetarian diet pattern was 25%. Also on metabolic syndrome, because metabolic syndrome is essentially a conglomeration of all these problems. There's a reduced risk of individual component of metabolic syndrome, except for HDL cholesterol, are associated with a lower waist circumference, lower concentration of triglycerides, lower load in LDL, blood sugars, and blood pressure. Now, plant-based diet and hypertension or blood pressure. Meta-analysis of about 7 randomized controlled trials and 32 observational studies found that vegetarian diets both decrease blood pressure, both systolic and diastolic, as compared to diets which are omnivores. Okay. In observational studies, vegetarian diets were associated with blood pressure readings that were on average 6.9 mmHg and 4.7 mmHg lower for both systolic and diastolic blood pressure respectively. Blood pressure reduction was independent of salt intake, overweight, and exercise level. A reduction in systolic blood pressure measured by 5 mmHg is estimated to result in 7% reduction in all-cause mortality, 9% reduction in mortality due to coronary artery disease, and 14% reduction in mortality due to stroke. So just improving blood pressure by plant-based diet will lead to a lot of decrease in mortality due to various metabolic disease. Meat-free diet has a huge impact on lipids, and it has shown to have reduction in total and LDL cholesterol, which corresponds with about 10% reduction in heart disease, according to a meta-analysis of randomized controlled trials which were published by American Heart Association. Vegetarian, especially vegan dietary patterns improve both fasting and PP lipids, blood lipids, compared with conventional therapeutic diets with similar effects, those seen with statin therapy. If combined with moderate physical exercise, cessation of smoking, stress management, reduction of lipids can be even higher. So what are the mechanisms which are responsible for benefits which are associated with plant-based diet? Several mechanisms are there. They are lower in calories if they are consumed in the right spirit. Increased intake of fiber, again, if they are consumed in right spirit with less of processed grains. Intake of vegetable and fruit should be high. Reduced intake of saturated fat and cholesterol if these diets do not have ghee in them. Higher intake of PUFA and UFA, especially coming from nuts and oilseeds. Increased intake of antioxidants and micronutrients, especially if the diets are rich in vegetable and fruit. Higher intake of vegetable protein if it is consumed in form of dals, and higher intakes of plant sterols, which are coming from nuts, oilseeds, so on and so forth. What are the shortcomings? Certain nutrients may be less abundant in plant-based diets when compared with diets with animal products. Also, there is a considerable variation depending upon specific diet choices. What are the nutrients? Protein, fat, particularly saturated fat, zinc. Zinc is very important, especially in COVID times, vitamin D and vitamin B12. However, manifestation of these deficiencies are not more common in vegetarian population than in omnivorous populations. And such dietary recommendations require appropriate guidance from a dietitian to ensure appropriate choice of food, cooking methods, and supplementation strategy. American Academy of Nutrition and Dietetics states that appropriately planned vegetarian, including vegan diets are healthful, nutritionally adequate, and may provide health benefits for prevention and treatment of certain disease. Appropriately planned means it is important to keep main sources of macro and micronutrients in mind and make sure that diet supplies one's need of all of them. Okay. Now, this is something which I have put purposefully because in India, if you are on a vegetarian diet, the source of protein becomes beans and legumes, that is dals and pulses. And most of our patients really do not like to consume them. But beans and legumes, dals and pulses have a huge effect on health. They have an anti-obesity effect with decrease in body weight and waist circumference. They have anti-diabetic effect where it improves glycemic control, increases insulin sensitivity, and decreases HbA1c. It has cardioprotective effect with decrease in cholesterol, decrease in triglyceride, decrease in blood pressure, decreased heart rate, increased vasodilation, and decreased inflammation. And most of all, it improves the gut health, colon health. It increases the microbial diversity and microbial composition. It therefore increases short chain fatty acids and decreases inflammation. So, in conclusion, plant based diets differ from vegetarian diets as they are lower in fat and high in fiber. And I think that is one thing that we need to encourage in Indian context. Plant based diets have shown immense metabolic benefit. Well planned plant based diets can be sufficient in protein, unlike what is thought. So it's very important to include a lot of dals and pulses in our diet. The only plant-based diet, only nutrient that plant-based diet lacks is probably vitamin B12 and vitamin D3, and this would require supplementation. Thank you so much for a patient hearing.